Kernig's sign of meningitis. What does this sign indicate? This sign is used to diagnose meningitis. This sign was named after Dr. Vladimir Kernig, who was a Russian neurologist. He used this sign to look for evidence of irritation of meninges. How to perform this test? Step 1. The patient should be lying straight supine. Step 2. You will choose either leg. Step 3. You will flex the hip joint at 90 degree and the knee joint at 90 degree along with it. Step 4. Now with the leg in this position, you will start extending the knee joint straight towards the roof. As shown in the figure, the examiner is now extending the knee joint of the child towards the roof. How the test will be called positive? During the last step of extending the knee joint, you will check for following points. That whether there is elicitation of back pain or spinal pain on extending the knee joint, or whether the patient reports that their neck pain or headache that they had prior to this maneuver is worsening with the maneuver of extending the knee joint, or whether there is a resistance to straightening of knee joint, the leg is resisting this maneuver, or there is involuntary flexion of the opposite hip joint. When any one of these statements become positive, then the test will be considered positive. What is the pathophysiology behind this test? This test involves the hamstring muscles. The hamstring muscles you can see in the figure are the muscles at the back of our thigh which are joining our pelvic bone to the knee joint. In meningitis, there is severe stiffness of these hamstring muscles. Due to this severe stiffness, this causes an inability to straighten the knee joint when the hip joint is flexed to 90 degrees. There are other diseases that also cause neck stiffness, but Kernig sign will be negative in these diseases like cervical spine disease or raised intracranial pressure.